Hello, I'm Amy and I'm a diagnostic sonographer and I work for virtual veterinary specialists. And I'm going to go through a very brief introduction to abdominal ultrasound with you today. So we're going to run through preparing yourself in the room, the different transducer types, probe and image orientation, the probe movements that we can use, image optimization or the knobology, and image interpretation, and how to perform a systematic approach to every single abdominal ultrasound scan that we do. Okay, so first of all, I need you to prepare yourself. This may sound really basic, but it's super important that you have everything at a height that works for you. Okay, so your stool, your table, and your ultrasound machine, they all need to be set at an adequate height for you. This will reduce any work-related musculoskeletal problems that you could potentially get. You're going to be in this position for roughly about an hour at a time, so you need to ensure that you are safe before you start. Then you can move on to your patient. Most of our patients are obviously, we want them sedated. We want to pop them into right lateral recumbency if they're able to. To prevent them from moving, if we pop a sandbag behind their back or something heavy, this can stop us when we're pushing quite hard with that probe, stop them moving across the table, okay, and gives us something to pop a little bit of pressure against and bring them close to you, okay. I don't want you overstretching because that can hurt your shoulder if you're constantly overstretching. So just small things to be aware of. And obviously with the room, if you can have all the consumables that you're going to need ideally in the room ready, such as your gel, spirit, covers for your probe, and any extra sedation that you need. Obviously, ideally, we want the patient sedated, and at VVS, we can advise on abdominal protocols for sedation. So please get in touch if that's something that you'd like as well. So preparing your patient, I've touched on this already. If you want to pop them into right lateral recumbency if possible, sedation, have you done any bloods prior to it? Are you thinking about doing FNAs? Consumables, we want them in the room. Have you got monitoring available? And then clipping the patient. We want quite a nice big clip. So the majority of it, we're going to clip this ventral abdomen up to the costal arches, preferably to include the last one or two intercostal spaces, especially in these deep-chested dogs. We're going to come down to the inguinal region caudally and the hypaxial muscles bilaterally. So the different transducer types that we have available are our convex or our microconvex probe here, the linear probe, and the phased array probe. Okay, so most of you will know already that the phased array, we're not going to be using this for abdominal. These are a small flat surfaced probes that are great for popping in between those intercostal spaces with a small narrow near field and a far field. They provide good depth and great for cardiac, but they don't really have much use in abdominal work. So the main one that we're going to use for abdominal is this convex or your microconvex. These are usually a mid to low frequency probe. They have quite a small footprint. They give good depth, but equally they are quite good for some superficial structures as well. So they're a good all-rounder. Most of you may have a linear probe available as well. These are usually a higher frequency probe. They have quite a large flat footprint though, which can make them difficult to use in some circumstances. They are beautiful for superficial structures. So your musculoskeletal work or your cat abdomens, especially cat GI tracts. If you've got one of these available and you're scanning a little cat, pop it on and you're bound to get some beautiful images. Okay, but the main one that we're going to be focusing on is this microconvex probe. So now we know the probe types, how are we going to hold them? So there's two main grips on holding that probe. The first one is this pencil grip where we pop our thumb underneath the probe and we hold it like a pencil. This allows you to have quite good maneuverability of that probe. You can twist it, rotate it, push it under and move it very easily. The downside with this grip is you're not able to sort of push through that probe quite well because you've not got a strong enough grip on it. That's where this racket grip comes into view, where we put our thumb over the top of the probe and it allows us a bit more power behind that probe, really. So this is the one that we'll probably use if we're scanning up under the diaphragm and pushing up underneath the xiphisternum to visualize that cranial liver. This pencil grip allows us to sort of rest our wrist down on that abdomen and come and use that as a buffer. And we can use this for most of the left-hand side of the animal. For the liver and scanning the right-hand side, we're most likely going to be using this racket grip. These grips may not work for you, okay, and that's completely fine, but it's important to try and remember to stay comfortable when you're scanning to reduce that musculoskeletal problems that you can get. Now we know which probe we're going to use, we know how we're going to hold the probe, but which way is which with that probe, okay? So most probes will have a little notch, dot, or a light on one end of the probe, okay? So this one has got a little ridge here that you can see that I've highlighted in yellow. This corresponds to the first crystals that are fired. So the first crystals that are fired from this probe are from this end here. On an image, you will get a corresponding little icon on one side of your image. Okay, so on this one, we've got a little T. Some of them you get a little S, a little E. They vary from manufacturer to manufacturer, but there'll always be something on your image. Okay, so this corresponds with this. So if we want a nice long axis view of the abdomen, we're going to pop the notch towards the patient's head. That then means that on our image, this is the skin surface, this is towards the patient's back, this is up towards the patient's head, and this is down towards the patient's bottom. So if we were to slide that probe straight up the abdomen, this image would go the correct way. Same as if we slide down, it'll go down with us, okay? If I say rotate into a short axis, or we want a short axis view of the kidney, we then rotate this notch dot light towards ourselves or towards the right-hand side of the patient. That then means that on our image, this little dot is now on the right-hand side of the animal, and this is the left-hand side of the animal. This is still the skin surface, and this is still towards the back. That's if they're in right lateral recumbency. Okay. The exception for this is if you're doing cardiac, and usually the image is flipped, so you tend to have your little dot over on this side, okay? I'm not going to go into that now, but just always check that if you've got an abdominal preset on, that you've got your little icon on this left-hand side of your image. And if you've got the notch dot light towards the patient's head, then this up here is towards the patient's head, okay? So there's 6 different probe movements that we can use. These are them here, but I think they're a little bit easier to see in real time. So the first one is sliding. And think of it as your probe as being on a tightrope, okay? So we're literally just going to go straight up and straight down that abdomen on a point of a tightrope, okay? Straight up and straight down. We're not going to move from side to side, just straight up and straight down. And we're just sliding that probe. The next one is sweeping, and we're going to go with the width of the probe away and towards us across that abdomen. Again, we're not sliding up and down for this one. We're just going straight out to the side and back. So we're only doing one movement. So we're just going to take a slice of this abdomen right the way down here and then right the way across this way as well. Okay, so they're the first 2. The next one is a rotation. So we've got the notch dot light towards the head and we're rotating it 90 degrees and we're bringing that notch dot light towards us or the patient's right-hand side and it's rotating, okay? You can, as I've just done here, rotate that probe slightly further back if you're struggling to see things, sometimes like elongating out of a kidney. Sometimes you just need to turn it slightly away from us, but most of the time, I only want that probe or that notch turning towards yourselves. Okay. The next one is fanning. So just literally think of it as fanning. You're going to keep that probe fixed upon a point. You're going to bring the probe out towards yourself and away from yourself, okay, on a pivot point. Okay, it shouldn't be sliding. And then you can do the same in the short axis as well, and you can fan it both ways that way. Let me just watch that one again. I think I do slide it a little bit in this video, but ideally you want the probe fixed upon a point all the way towards yourself and all the way away, rotating it into short and doing the same in your short axis as well. Perfect. So they're the first four. The next one is your rock. So this one is where you're just literally rocking the top of the probe forward or back. Think of it as your rocking horse, this one. And this one is useful for if you've got those tricky kidneys that you can't quite get horizontal across your image. If you use this rocking motion, you can bring it a little bit more horizontal across your image. Nice. And the last one is the one that everyone seems to forget about, is just the pressure that you're popping through the probe as well, okay? So applying pressure and releasing it. So if you've got this probe pushed in quite deep like here, you could be compressing things. You could be pushing bowel away, you can be compressing vessels, and you're not going to see everything. So sometimes just releasing that pressure a little bit will help you see a lot more. Equally, on the opposite end of the scale, sometimes by applying that little bit more pressure, you can disperse that little bit of gas, or you can just get that little bit closer to that thing that you're trying to visualize that little bit better. Okay, so they're the 6 probe movements that we can do. So now I'm going to go quickly through different types of machines, okay? So I know you'll all have something slightly different. Some of you will have this little laptop machine. Some of you will have this static larger machine. They all do the same, okay? It doesn't matter if you've got one of these or one of these. They still do the same. They will all have a slightly different layout, and they do look quite scary because of all these different buttons that are going on. I'm going to introduce you to using maybe 5 or 6 of them. And that is most of what you'll need to do a good, thorough abdominal ultrasound scan. I can happily go through the different machines with you in practice or via the VBS workstation. And then you can start to learn where these buttons are on your machines. Okay. So I've included this one just as a bit of an overview, really, because what makes a good ultrasound image? Are any of these a bad image? Or any of these a good image? You know, someone could say, I love this one. You've got your measurements on, it's showing the kidney. It's absolutely fine. This one, it's showing my free fluid, it's showing the pathology. Someone could say, oh, I really love this one. You've got a beautiful high resolution image. You've got both poles of the kidney on. It's nice and horizontal. Okay, so we all will see something slightly different on each of these machines and prefer something slightly different. However, we do all need to learn to optimize an image. So something like this, we've got a lot of extra tissue below the kidney. So this one, personally, I would have reduced the depth a little bit so that we've cut this off and we've brought this kidney into the middle of the image. Therefore, you will get a better view of the kidney and you'll be able to measure it more accurately as well. Something like this is probably a little bit dark, and same as this one, especially the far field. So I'd have adjusted these to make them a slightly better image. So these are the 6 basic presets and functions that I'm going to go through with you. There's obviously other ones like your freeze button and your save button that we'll probably need to use an annotation and measure. But these are the main 6 functions that we can go through. So the first one is your preset. So this is when you click on abdomen or small dog abdomen, large dog abdomen, cat abdomen. This will then give you a baseline for that scan, okay? So the manufacturers have put into that machine what they think you need for that medium dog abdomen. That preset should usually adjust these other 5 for you. Well, these other 4, it won't affect the TGC unless you've got a brand new machine. This is a manual function, okay? So your preset will set all these for you at what it thinks you need. However, I want your left hand that is going across that ultrasound machine moving as much as your right hand is moving across that dog, okay? They should both be working as hard as each other. because you should constantly be changing the functions on that machine as much as you're moving around that abdomen to adjust your image and get beautiful images all the time. Okay, so the first one is the frequency. And I did say I wasn't going to go through much physics, so I'm really sorry I did lie a little bit. There's just a little smidge of them here for you. So frequency is just the rate of generation of sound waves. It refers to the number of sound waves that occur per second. Okay. So if you think of a low frequency probe or low frequency, so this one is 3.5 megahertz, a lower frequency is going to give you a longer wavelength, which will allow you to penetrate further. This will then give you a moderate or a lower resolution image here. This one here is a higher frequency, but it'll give us a shorter wavelength. It'll give us a better resolution, but we can't penetrate as far with a high resolution, with a high frequency. So there's always a trade-off, okay? So think of it as low frequency, you get more depth, but a lower resolution. High frequency, high resolution, but lower penetration, okay? So your big dogs, low frequency, your little tiny kitty cats, high frequency, okay? And obviously we will probably need to adjust this through the scan. So if we're looking at the abdomen, we're probably going to need a lower frequency than when we're looking at a kidney because of the depth of what we're going to need to be traveling. Okay, so the next one is our overall gain. So think of this as the volume for your ultrasound machine. Okay, so it's how bright or how dark the whole image is going to be. And all the overall gain is doing is amplifying the returning echoes to your transducer throughout the depth of the image. Okay, so if you decrease the overall gain, you'll get an overall dark image like this one here. You increase it, you get a bright image like this one, or an oversaturated image. This is where your gain is set somewhere between the two. It's set perfectly, okay? Overall gain will be shown by a number on one side of your machine. So some machines will go from 0 to 100 for the overall gain. Some will go from 0 to 255, which is the sonoscapes for some reason. A rule of thumb is you want that overall gain set about 2/3 to 3/4 of the maximum. Okay, so on your machine, just turn the overall gain right the way down to the bottom, see what the number is, turn it right the way to the top, see what the highest is, and aim for about 2/3 to 3/4 of what that overall is. So the next function that you can use in conjunction with the overall gain, which, like I said, amplifies the returning echoes to the probe throughout the depth of the image. Your TGC, or your time gain compensation, or your sliders, as a lot of people know them as, which are these, the little line, does the same. So it still amplifies the returning echoes to the probe, but it does it for a set depth through that image. Okay, so if we look at these here, this one here is for the near field, this one the next step down, and so on until we get to the far field. So we use the TGC to achieve a uniform grayscale throughout the depth of your image. Okay, so if we look here at this bit of liver, this is with the TGC set straight down the middle. We can see that we've got quite a nice bright near field of that liver. However, this far field is quite dark, okay? And that's because these echoes down here are having to travel further than these up here. So they need a little bit of extra oomph. And that's where your TGC comes in. So if we take this bottom 2 or 3 or even 4 of them to the right-hand side, we'll get that even grayscale throughout the depth of the image there. Mainly, and you can do the opposite when you go to the bladder as well. So if you think you're looking at a bag of fluid, you tend to get that really bright far field. That's just because the sound's traveling quite quickly through that fluid. So then if we can decrease those echoes in the far field, you'll get rid of the brightness behind that bladder as well. Okay, so again, use this continuously throughout the image, throughout the scan. The next one is a simple one. It's just the depth. Okay, so it's just how deep you are penetrating through that abdomen. The rule of thumb is if you want to bring the region of interest into the middle of your screen, it doesn't matter what it is, you just want it in the middle of your screen ideally. That's where you're going to get better resolution and you're not filling the screen with too much. So it's too much to look at. Your eyes can't concentrate on what you're trying to, or too little. Okay. So if we just look at this, it's just a couple of little vessels. This one here, we've cut the bottom of one of them off. Okay. So we need to increase that depth just so we can see the bottom of this vessel and anything else that could potentially be going on around them. You know, if there's any big nodes around them, we want to see them. This one here, you can see that they're quite small. They're shoved right at the top of the image and we can't see them particularly clearly. So you'd need to reduce your depth a little bit here. So next one is our focus. And that's usually indicated along the side of our image with like a little arrow, a little asterisk sometimes. Again, there can be various things down the side of your image, okay? Just learn what they are on your image. The focus narrows the ultrasound beam at the level of where it's set, okay? So it increases the line density there, so you get better image resolution. So we want to set that focus at the level of what we're looking at or just below it, okay? So therefore we get better resolution at the area of interest. Most of the time in abdominal work, we'll have a single focus. You can have additional focal points or multiple focal zones. This, however, will give you a slightly lower frame rate because the machine is having to do too much. The consequences of a lower frame rate is that you can get a laggier image and you tend to get that sort of really swishy type image because you're not getting a live time image there. That's why we tend to keep it at just one focal zone for abdominal. Some of the newer machines, and I didn't say this with the TGC, they're moving to a automatic focus. Okay, so you no longer have to worry about this on the new machines. It does it for you, and it sets it, and it seems to be working quite well. And also with the TGCs, the sliders, they are also going to a more touchscreen version, and they can include that within the presets as well now. Okay, so let's have a little look at an image. Now I've done the boring bit. So this is an image that was taken probably a few weeks ago on one of our VVS scans. And as you can see here on this left-hand side of the image, there's a load of random numbers and letters. Okay, these are actually really important. So like I said with the overall gain, which is here, is GN, it gives you a number value for it. So this is a sonoscape. So this goes from 0 to 255 here. So this is set about 2/3 of the maximum, which has given it a lovely, beautiful, even grayscale throughout that image, which I don't think is too light or too dark. Okay, we obviously can't see where the TGCs are set, but I would say they were set quite nicely. The other values that we've got here is the FPS, which is the frames per second, which is set at 31. Ideally, we don't want that to go below 19. When it goes below 19 is when we get that laggy image. Okay, so your GN is your overall gain. Your power is set at 100 here. Frequency is set between 6 and 7.8 here. D is your depth, which is 8 centimeters, which we can also see down this little bar on that left-hand side, right-hand side as well. And we can also see here with this little pointer that our focus is set right in the middle of our region of interest. So this is a beautiful, well-optimized image we can see here. You probably could say we could reduce the depth maybe a notch. However, here, the reason it's increased is so you can see those rib shadows. So this image is showing us that we've got a mass in the head of spleen, even though it's not labeled. The technique that we will use for every abdominal scan will be the same, okay? We tend to use a systematic clockwise approach to every single scan we do. That way we know what we're going to do and throughout the scan, it helps us build upon normal as well. So you start to build up a normal anatomical database in your head. I know you know your anatomy really well. However, it is different visualizing things on ultrasound to when you're opening up that dog or cat. Okay, the consistent approach allows us to appreciate the 3D spatial mapping of the organs also. Okay, so it's important that we know the layout of the organs and how to fan right the way through them. And also by keeping this systematic clockwise approach, we can visualize the organs from more than one approach. So things like if we can't see the pylorus, from the start of the scan, we can go back underneath the dog at the end. We can try and find the pylorus from underneath. Okay. We can also visualize most of the small intestines as well from either the left or the right hand side. So yeah, normally we would start midline, underneath that zippy sternum, angling quite cranial, so we can get visualize the cranial liver and the diaphragm in that first visualization. That way we can have a quick view into the thorax as well, especially if you've got a critical patient. We can have a quick view, make sure there's no free fluid up there. Okay, then we can have a good look right the way through the liver, the gallbladder in both long and short axis. And we can start coming down that left-hand side. Visualize the stomach, the left limb of pancreas, spleen, kidney, adrenal, down a little bit further caudal to the aorta and caudal vena cava. Have a look, see if we've got any great big lymph nodes there. Then we can then come down to the bladder. If the dog's entire, we can have a look at the prostate and uterus. Then we can pick up the colon from the bladder. We can come back up that left-hand side of the dog by following that colon up, bringing us back up to that zippy sternum almost. Then we can have a really good sweep right the way through the abdomen, checking out the small intestines, seeing if we can see any nodes, see what the mesentery looks like. Depending on how you want to scan the right-hand side of the dog, we can either keep them in right lateral, go underneath the dog and pick up that right kidney, right adrenal, ileocecal junction from there, pancreas, pylorus, small intestines again, and lymph nodes from that right-hand side. Or you can turn the dog into left lateral and you can scan the right-hand side while it's on top. It's entirely up to you and on positioning wise. Now we know what technique we're going to use to go right the way around the abdomen. How do we assess individual structures? Okay, so we know our liver anatomy. We know that we're going to pop the probe underneath the zippy sternum and angle cranially, just so we can get the diaphragm as well into view. We're then going to have a really good sweep right the way through that liver in long axis and both in short axis as well. So if you imagine that we're going to hashtag right the way through the liver, like this really bad diagram, okay? And I'll just show you on a little video what that can look like. So we're going to pop the probe underneath the zippy sternum, angling cranially, and we're going to fan up towards the ceiling through that left-hand side and then down towards the table, okay? And we're going to acquire multiple lifetime images in long axis all the way through that liver. Then we're going to rotate into short axis. We're going to take the notch towards yourself or towards the right-hand side of the dog, and we're going to fan up towards that left-hand side and back down to the middle, right the way up and right the way down, and to the right-hand side as well. I'll just show you that again. So long axis underneath the ribs, angling cranial, fanning up towards the ceiling, and all the way back down to the table. So we'll pick up the gallbladder on that side, rotating it, going back up to the left-hand side, sorry. Then we're going to rotate into short axis, notch to you or the table, fanning up through the midline and all the way back down, up towards the left-hand side, hooking underneath those ribs and all the way down and to the right-hand side as well, and all the way back. And we'll probably have to do multiple sweeps in both long and short axis, especially in a dog like Bon here. He's probably got a moderate sized liver that's all tucked up underneath these ribs. So we may need to do several sweeps in long axis and short axis to ensure that we've covered every single millimetre of that liver in this hashtag appearance. Okay, that same technique we're going to use for every single organ. Okay, so with the kidneys, we'll sweep through it in long axis and then in short as well. Same with the bladder, all the way through in long axis and all the way through it in short axis. For things like the small intestines, we're going to just make sure we've gone right the way through the majority of that ventral abdomen, visualizing it in long axis and in short axis. Okay. So once we've got those structures on ultrasound, how do we assess them? So I use this little acronym of SSOTM. So if you've got something like this and you're trying to explain it to your colleague in the next room, how are you going to do that? Okay. So if you can just go through it in your head of rough size, the shape of it, the outline of it, the texture of it, or the echogenicity of it on ultrasound, and then the measurements of it as well, lastly. Okay, so if you can give all that information, you can help that person build up a picture in their mind of what this looks like. That's all I'm going to go through very quickly today. So we've gone through probe handling and movements, basic machine functions, and a very quick and basic scan technique. So I hope you found that useful, and let's continue building on these skills together and perform abdominal ultrasounds. Yeah, and I hope to be able to work with you very soon on the platform, along with our internal medicine specialists who join us at the end of the scan, and they can give you a case review and what to do next with the patient, depending on what we found on the ultrasound scan. So yeah, thank you very much for listening, and hopefully see you soon.